We're so glad you're with us today. If you've ever dealt with a skin condition called rosacea, you know the hard-to-cover skin condition can be slightly embarrassing, sometimes a little painful.
But as Dr. Patrick Davey is going to explain to us, there are some treatments that can help, and we appreciate you coming in. Thank you very much.
Well, thank you for having me. I appreciate it.
Oh, who gets this? What causes it?
Well, it's actually a little bit older group than the teenage acne, or what we call acne vulgaris, common type of acne. It tends to be people in their 30s to 50s is where we'll see it. There's certain groups of people. The Celtic people, Scandinavian people tend to have more problems with it. Women, when they get menopause, actually can develop acne rosacea.
And we see on this slide, it is pretty severe.
Yes.
Or can be.
And we have a couple of different components there. We have the sort of breaking out component with what we call pustules and the cysts, and the deeper component like you would see in teenage type of acne and common acne. And then we have this redness, which is from blood vessels. And the redness is the component that makes acne rosacea unique. That's caused from inflammation in the skin. So the skin gets inflamed.
It's kind of an emerging area that we're learning more about the role of inflammation.
Yeah, in a lot of diseases, and this is one where I think it's particularly interesting to us, because it's something you can actually see, and therefore when you treat it, you can see it go away. We, for years, have used a medicine called tetracycline, which is an antibiotic, and we thought, we're taking care of bacteria in the skin. What we're probably taking care of is inflammation in the skin, and we're not really sure exactly what causes the skin to be inflamed. And you see new treatments, like the one that I think is particularly interesting is in New Zealand now, they're using honey. So they have New Zealand honey that they're putting on as a topical, and it seems to be effective in terms of decreasing the inflammation in the skin for patients with acne rosacea.
Is this something where you just get to the point where you control it, or can you actually cure it in people? It's
really a control issue that we have with it more than anything else. We usually start out and kind of throw everything at the patient, and then once we get them in better shape, then we can back off and use generally topicals. We'll take care of it. It can also involve the eyes, which is certainly a reason for you to go ahead and have some treatment. You can get red, itchy eyes, and that can be from rosacea. So we definitely need to see patients when they get to that point.
Yeah, absolutely.
Well, we appreciate you coming in. Good information.
Well, thank you very much.
Thank you.